Dr. Meyer, you're a holistic dentist. Can you explain what that is and how it may differ from what other dentists people see?
A holistic dentist, well, it depends on who you speak to, first of all, their
Okay.
idea of a holistic dentist. There's a holistic and biologic and then traditional. I think the best way to kind of categorize the traditional dentist, what you're used to, they really don't pay much attention to diet, nutrition, and what maybe a traumatic bite will do. They don't look for the cause necessarily as much as how to fix it. Okay, you've got a cavity, okay, we have to drill it. A biological and a holistic dentist would say, okay, you have a cavity, well, why? You know, why do you have the cavity? Let's look to find out why. And then we can, you know, we can fix it for you, but perhaps it's in a position where we can reverse that decay and you don't have to have it fixed. So we have to look at all the other contributing factors in that person's life to make that decision. The main difference, I would say, between a biological dentist and a holistic dentist is their view on root canals. And once again, this line is somewhat blurry, depending on who calls themselves what. But a sector of the biological dentists will still place implants, and they'll still perform root canal therapy utilizing more biocompatible materials and disinfecting the tooth with ozone versus maybe bleach like a traditional dentist would. A holistic point of view would say root canals are generally, I mean, you cannot disinfect a root canal. It's a dead thing we're keeping in the body. If you choose to hold on to your root canals, let's monitor your immune system. Otherwise, it's best to extract them because we do know that they put off toxins and, you know, bacteria and toxins on a regular basis. So where's your immune system at, and is it hurting the immune system? So it kind of, does that help you to understand the three? And then we look at the material selection that we're placing. So the traditional dentist, I'm going to use this traditional biological and holistic. The traditional dentist looks for the material that's going to work best in their hands. You know, the porcelain fused to metal crowns, well, those are typically aluminum fused to nickel. So we're looking at two carcinogenic materials. And then they're building up the crown preparation with an amalgam filling. So they're not paying attention to the laws of the electricity of oral galvanism. When you put two or more unlike metals together, you're going to create a huge battery in your mouth. So we've got a lot of different issues over here that they're not looking at, that the biological dentist is much more in tune to. So we're looking at compatibility of materials for crowns, for fillings, for mouth guards, for, you know, even denture cream, you know, what's for you the best. And that's done with usually a blood, a biocompatibility blood test, which runs all the different dental materials that you can use. And then we pick and choose from that. In my office, I do that, and then sometimes use a biofeedback technician to kind of energetically test the materials to make sure that what was shown in the blood as an allergy isn't also energetically disturbing to the system.